And do you have examples? I know we talked in our pre-meeting about some, without giving details, obviously, protecting the privacy of patients, but, any examples that you've seen in your practice that would be really useful to demonstrate this interconnection of the physical and the emotional.
Yes.
And
Great cases.
Yeah.
One that really did affect me, and I had a teenager. She came in with her mum. I was seeing her for many, many, many years, even my previous job as well. And when I moved to Parramatta, she came in, and her mum was worried about her because all she was experiencing is headaches and nausea, and no one could explain why she was getting the headaches and nausea. And she's done tests, blood tests, scans, brain scans, everything. For a teenager, it's a lot, especially when you don't have a diagnosis and no one can tell you what's wrong with you or even help you out.
Yeah.
And she's seen chiros, physios, everything. And she came in and she was like, look, we've tried everything and I don't know what to do. And basically, something didn't add up because the daughter was quiet. She didn't want to speak. Mom led the conversation. And I didn't need to investigate further because everything was done. So it was just like a light bulb moment when I sat her up because she was on the bed and I was releasing her neck muscles. And I sat her up and I put my hand on her shoulder and I said, how's school? And that's when I got that outburst of emotions.
Wow.
And her mom was taken back a little bit because I don't think she wanted to discuss what was happening at school or open up about it. And she looked at me, the girl looked at me and she said, I'm getting bullied at school. Wow. I hate school. And I had to stop and think, all right, what do I do here? Like this is a lot, a lot to take in. And that's when we sat down and said, all right, well, this needs to be addressed. And
so then do you kind of help with referrals to other resources that would help in that kind of situation?
Yeah, so the mom was very open about it and she was like, all right, what do I do?
Yeah.
Clearly this is affecting her. This could be causing the headaches and the nausea.
Wow.
And we all said, you know what, you need to speak to someone. You need to speak to a professional.
Yeah.
And a year later, the girl was actually feeling a lot better.
Yeah.
Changed schools, seeked help.
Yeah. Thank you for that example. I think what it really highlights is, that interconnectedness. Our experiences can cause physical issues, and recognizing that often we think headaches, nausea, there must be a medical, biological thing, but this is a psychological, social thing that was impacting her body, and being able to connect the two is so powerful. Yeah. Sammy, what about you? Do you have any examples that you think that resonate for you and how it's informed your practice?
Geez, there's been many over the years, to be honest with you. One of the most recent ones I had was a middle-aged man who came in with lower back pain, had a lot of injury to his lower back. He had previously had quite a physical job to do, and that would often trigger his lower back pain. It would normally settle down, but this time it just hung around. And I would go through questions with him regarding his back pain. And then when I got to timeline questions, he'd always answer me with reference to his father passing. So this happened X amount of months after my father passed away. This happened X amount of time before my father passed away.
That was his timeline.
So that was his center, right? And so very quickly I was able to kind of go, okay, well, there's something to this, right? And so rather than kind of having set questions that I go through, I went through the normal treatment process and the normal, because there was a physical aspect to his problem.
Yeah.
So we don't want to discount that either.
Yeah.
We don't want to kind of just say, this is all in your head. That's not a good way of going about it. And so we went through the normal treatment process. And as he's laying down on the bed and we're treating, in conversation, we'd kind of discuss things. And then usually, not usually, but what happened with that particular consult was at the end of it, he got ready and we sat down, and I normally go through the planning process for treatment. And then I basically said to him, I said, look, this is coming up in your history. And based on my experience, this is something that really is for us, it's what we call a yellow flag. It slows you down. It takes time to get you better. And I was quite direct with how I said it, because I just felt like that's what he would appreciate.
Yeah.
And so some people you can be direct with, and some people you can't. And it was something I was direct with him with. I said, look, this is something that's obviously affecting you. And he admitted it straight. Yes, it's affecting me. And as he's talking, there's a few tears. So tissues in the treatment room always help. And as they start to kind of release that, more stuff comes out. More things come out. And then, with time, and with his own kind of work, things are able to improve. With something like that, especially with a death in the family, it's not like it's something that's always going to be with somebody.
Yeah.
And it's a real process. But it's not so much about dealing with it rather than just recognizing it.
Yeah.
Awareness
about it. I mean, if
Yeah.
it's obviously really bad that he needs to deal with something, then he can go and deal with something. But sometimes just awareness that he's aware that this is happening, and then he can kind of almost pull himself out of it.
Yeah.
And that it's impacting him. Like, I don't think that in society in general, but particularly in our community, we understand how much we carry the weight of our emotions in our bodies.
Yeah.
That like, especially people who internalize generally and don't communicate as much, it's got to go somewhere. We can't just keep it in and it's all fine. There's a cost somewhere. And sometimes that cost will come out physically if it's not coming out verbally.
It will definitely come out physically. Like, I mean, just to give you an example, the nerve supply to the heart is in the upper back. And that's why you get people when they're quite anxious and they have a lot of anxiety, they usually got a lot of tension in the upper back and neck. It's very, very common.
Yeah.
And so with that particular patient that I told you about, his particular way in was that to recognise that there's a physical manifestation to what he went through, and then try to enter that through the physical side.
What was kind of acceptable?
So we looked at things like, okay, how is this affecting you? I'm not sleeping very well. His diet kind of wasn't that great. He stopped exercising. And so they're the big three things that, I mean, just for people who are, generally the general population, the three biggest ways you can affect your health is through sleep, diet, and exercise. If you get those three things right, that's 80% of your health sorted out. And so we use that as a strategy. So, okay, so you're not sleeping because you're thinking about your dad. Okay, well, let's see how we can help you sleep. Okay, you're not eating well. Let's see how we can help you eat better. Let's look at your diet. What are you eating in the morning? Oh, I'm not really having breakfast. Okay, let's look at fat and protein for breakfast.
So it's that holistic approach.
Yeah, so, and then exercise. Okay, well, you're not exercising. He used to be quite physical. Just go out for a walk, get walking, and then slowly start to increase the load. As they start doing those things, that presents an entry point, and the emotional stuff starts to release easier. And then, things then they'll start talking to their cousins and their friends and their family and their colleagues, and then things get released that way.